see quickly the conjunctiva. We're going to see it in a very quickly way. The conjunctiva is, here's the eye. We put the eye. The conjunctiva is the most superficial layer of the eye, don't bring the cornea. So here we have this white is the sclera. Here we have the pupil that is black because it is a hole and we're seeing the pigmented epithelium of the retina. Covering the pupilla is the cornea, so here would be the cornea, and covering the sclera is the conjunctiva, so this would be the conjunctiva. The conjunctiva would be reflected here on the eyelid. So here we have the eyelid. There will be a reflection. And so the conjunctiva covering the sclera is called the bulbar or ocular conjunctiva, and when it reflects to the interior part of the eyelid or the posterior part of the eyelid, it is called the palpebral conjunctiva, and this reflection occurs at the fundus of superior and inferior fundus in the fornix, and sometimes there is also the semilunar canal in which in a sense we can have like a third eyelid anyway. The innervation of the conjunctiva is by the nasociliary nerve, lacrimal nerve, frontal nerve. All these are branches of the ophthalmic branch of the trigeminal nerve. The blood vessels are branches of the ciliary vessels, and they run superficially to the blood vessels of the sclera, and they will do anastomosis. Here, around the pupilla and the iris, let's say this is the iris, there is a limbo. This limbo is called a corneoscleral limbo, and around the limbo is the conjunctival, the bulbar conjunctiva, that is around 3 millimeters. So here will be the bulbar conjunctiva, and here will be the other part of the bulbar conjunctiva. The epithelium of the conjunctiva is columnar or squamous epithelium, stratified epithelium, and then it would change. There are many glands on the conjunctiva, including caliciform, including goblet glands that produce mucus, and so the mucus layer of the weeping that occur on the eye is made by the conjunctiva.